Hi, and welcome to week 3. This week, our theme is really to focus on the effects of childhood trauma on the developing person, to really think about the brain and the body, and how the personality develops, and how the experience of dissociation or hypervigilance really stems from having experienced trauma. So we kind of encourage you to pace yourself so you can fully engage with the material in the sessions and still maintain a high level of self-care, knowing that when we talk about trauma that's happening to children, and we really think about the lifelong impact, it can be really disheartening. Um, so some things I just want to mention about childhood trauma, and this is really from the National Child Traumatic Stress Network. Is that it's really just more common than we would like to think. We look at statistically, really more than a quarter of youth in the United States experience a serious traumatic event by usually their 16th birthday. And many children we know suffer multiple and repeated traumas. Um, we do know that after a crisis or a traumatic event, that a child is at risk of developing traumatic stress. And then about 25% of those children will go on to develop post-traumatic stress disorder, depression or anxiety disorders. And, I really liken trauma to almost a wound, and that is sort of where the word stems from. And then we look at post-traumatic stress disorder almost as an infection on top of the wound that's healing. And so we know with infections that happen to wounds that sometimes that actually becomes the greater focus after a while and presents all sorts of different complications. We know that with children, traumatic stress really affects and impacts learning. Their ability to concentrate and learn, because their brain state is really in a primal survival mode all the time, rather than one that is in their cortex and that cognitive thinking, planning part of their brain. We know exposure in infancy and also early childhood, because the brain is dramatically making such neural connections and wiring in such an intense way, it can really delay development of brains and their bodies. We definitely know that trauma in childhood changes the way children often view the world and their relationships and their futures. It does so in adulthood as well, but in adulthood we tend to have more buffers and can make meaning of situations and often have a support system and other things in place. We tend to associate trauma less with complete disfigurement of our identity, whereas childhood, because children are naturally egocentric at their developmental stage, it has a deep impact on how they think of their own identity. So as we think about children, I also want to share just a message of hope. We do know that caring adults can help. Caring adults around children, their ability to listen, to connect, to be protective, can make all the difference. And these could be parents, caregivers, it could also be teachers or other adult individuals in children's lives. We also know that treatments do work. And so treatment from clinicians and others who either use cognitive behavioral interventions. This is kind of one of the most well evidence-based traumatic interventions for children, or other types of therapy, somatosensory approaches, or kind of new trending interventions like parent-child interaction therapy. These have been found to be really effective in supporting a child in progressing and healing from trauma. So looking at the week ahead, you can see that we would start with our readings and some of our media. And our focus for the activities this week is to really help you increase your own knowledge of affect regulation and dysregulation, and seeing this as a potential consequence of trauma. We want you to be able to identify the impacts of trauma as they accumulate from childhood, thinking about your own process as you work with trauma-related course information. What are some of your self-awareness pieces? And also to be able to demonstrate techniques that are geared to increase affect regulation, emotional regulation, trust, and relaxation. And we begin our technique demonstrations. And this is just a great way to add some new skills and approaches to your toolbox. So to begin with, you will complete the readings for this week, and you can see that we have readings in each of our 3 books, as well as another article. We have a PowerPoint, and so you'll review that, and then we have a couple of videos. So I want you to watch all of the following videos: one on childhood trauma and affect regulation, one which is an interview with a child abuse victim. So our first real activity for this week is to start with the discussion forum, and it is, again, using the multiple dimensions of social work practice. This is really just getting you to think from different lenses about the impact of trauma. So to this end, you will be switching the role that you had last week, and you'll base it on the letter as we did last week. This week, your focus is going to be the case study that comes from Chapter 6 of the Perry text. And we know that you can focus on either Justin or Connor and really assess whatever dimension you're assigned to and follow some of the prompts for the questions. From the discussion forum that I've seen, seems like people are in the course are really doing a wonderful and thorough job at commenting on these different aspects. And my encouragement to you is just to continue to make sure that you are including the course readings, that you are addressing all the questions, that you are using subtitles to organize your response, making it really clear that you've answered each of the aspects that are asked in your dimension. And so you'll move on after the discussion forum. This is due by Thursday. A couple people had questions about our responses optional. This is a new focus in our course, and they are optional. So we do encourage you to read through people's different initial posts, but the response itself is optional. And here is an example from the Danny case. This is just an example. I know this was a little confusing to some people. And so it is to give you a sense of what each dimension might look like and what we're expecting. So you can see and look through that. The next thing is we will start in this week to have our technique demonstrations. And within this, if you are assigned to this week, you're going to post your technique demonstration video in here as your initial post, and you will also post the written instructions. The other thing is, if you are assigned this week, you want to make sure you've also submitted your technique demonstration for grading under major projects and assignments. This is something that has been tricky for people in the past. You want to make sure you submit everything there as far as your written instructions, because this is the area that we're able to grade in. And if you are not assigned to this week, you don't need to complete an initial discussion forum post. You just need to review each of the peer demonstrations that were done for the week, and then respond to each of your peers. And there's some guidelines for the response. The responses are due by Sunday. If you are one of the people assigned to the technique demonstration, it is due by Thursday of this week. And the final assignment for this week is to submit your literature review, the types of trauma and populations. Again, this is an individual submission, and all of you by now have submitted your 2 articles for review on the types of trauma and population. And you will receive feedback in the next day. And that is really just to ensure that your articles are appropriate to your topic and your population, and that they fit within the guideline, which is really 10 pages or more within the last 10 years, to make sure it's a recent piece of research and that it's not a literature review in itself. I will provide feedback on that, and for the most part, have everyone progress forward to their literature review. And so that is our final piece of week 3. It's going to be important that, again, you keep your self-care in mind as we continue through this week. Continue to practice it. Reach out for any questions that you have, and enjoy the week.